So one of the key concepts that stood out to me in the podcast was the pharmacokinetics, which is one of the phases of how our body actually processes drugs. So in this phase, the process was compared to a morning commute to work in the podcast because it is the process that involves the drugs consumed to navigate through our body. So to put it simply, pharmacokinetics explains what our body actually does to the drugs that we consume. So this session helped me understand why some medications are consumed orally and why some are given through injections. So in general, pills that are consumed orally will follow the slower route when it comes to its effectiveness, while injections will follow the faster route. So this is because the quicker the medication enters our bloodstream, the quicker the reaction time or its effectiveness. However, this poses a high risk of addiction as it creates a massive spike in the neurotransmitter levels, creating a euphoric effect. So this explains why patients with mental health issues that require medications are prescribed pills, because the goal is to help these patients reach mental stability instead of a spike of relief that would result in a crash once the injection wears off. Okay, so one of the ethical issues related to psychopharmacological treatment mentioned in the podcast was finding the correct dosage of medication. So a mistake in the dosage would actually risk someone's life as we know it, which is why there is a gap between relieving symptoms and stopping someone's heart, known as the margin of safety. So the margin of safety for SSRIs, which is one of the antidepressants, was not as narrow as the old antidepressant drugs, which is why the creation of SSRIs was considered a massive breakthrough in the field of medicine for patients with mental health issues. So the wide margin of safety for SSRIs means that it would have to take a lethal amount of dosage to actually stop someone's heart. So this session definitely helped change the way I viewed the role of medication in mental health care, because it is clear to me now how important it is for doctors to decide on the correct biological intervention for each patient due to how sensitive our brain and body are to drugs consumption. So, however, I am curious whether it is possible for patients with high dosage tolerance to still consume medications such as antidepressants within the margin of safety range if their tolerance were to increase over time. Thank you.